question is, do you believe that the high quality service that you're providing is meeting the needs of the patients and carers who use it 7 days a week?
Thrombolysis was only available from 9 till 5 days a week, and it was not available at all at weekends. I can only now wonder what would have happened if I'd have had my stroke on Friday night or Saturday morning.
Oh, good afternoon, Ken.
Hello.
How are you?
Good afternoon.
Come in.
Thank you.
You know Josephine, don't you? We've been married for 62 years and we've been in farming all our lives until my retirement. Josephine's health this last 3 years has not been good. How are you today?
I'm fine, thanks. I'm fine.
7 day working is a really big part of the intermediate support team and is very necessary, purely and simply because of the intensity of the support that's required by our clients. You know, it doesn't finish at 5 o'clock on a Friday. It's amazing how often in our case things happen at weekends almost as if by pure bloody mindedness sometimes. It's nothing to do with the way things are. You can't even contact your own GP at the weekends. No, you get put through to whatever it is. And I tried, when Josephine was going through a very bad patch, one weekend, that was at the weekend, and I was put through to some medics at Carlisle. And they said, we can't do anything. Well, one wouldn't expect them to do anything from Carlisle, 60 miles away from here. I can do nothing until Monday morning. And everybody's phoning that person or those persons on Monday morning, so it's difficult to get through.
When we first started discussing working 7 days a week, this had been something that had been raised many, many times with the staff, but always we'd put it away again as far too difficult. There were far too many issues for us all to tackle.
As HR business partner for the service, I worked closely with the management team and the clinical director, so the consultation process was very well planned out, in that we worked very closely in partnership with the staff side, the union representatives in the organisation, and staff opinions were taken on board throughout the process. There was possibility for individual discussions with the staff, and we utilised the flexible working policy and procedure to deal with any individual issues.
Obviously, we've got great role models in our nursing colleagues who have always worked 7 days a week and have always been on the wards and covering the wards. One of the factors that had always prevented us implementing 7 day working in the past was we didn't know how much it was going to cost us to do so. Therefore, in our scoping exercise to begin with, we looked at how much we were actually already paying for an emergency duty service over the weekends. And to implement our emergency duty across 3 hospitals was costing us somewhere in the region of £33,000 a month. By changing the rates of pay and bringing it in line with Agenda for Change, we've been able to put 41 staff working over the weekend for a slightly less cost than we were before. So every month we're spending about £3,000 to £5,000 less than we were for an increased service.
7 day working has impacted on my work-life balance in both some positive and only a few negative ways. Initially, we were quite concerned, I think, as a team of therapists, that 7 day working would have a big impact, in that it might mean less time with our family, less time perhaps playing sports at the weekends or doing other hobbies, and some of my teammates also do voluntary activities at the weekends. However, as the Trust undertook some consultation periods, we found that only the full-time staff work 1 in 5 weekends and part-time staff only need to work 1 in 7 or 1 in 10 weekends, which I think is quite reasonable. And as a team, we all felt that there was a real benefit to working 7 days for our patients.
One of the major challenges was to convince colleagues that we really needed to implement this. I think people understood the benefits in terms of quality of care, patient safety, length of stay, the expensive resource of spending extra days in hospital if you haven't had a consultant review that might have allowed discharge. But I think the real challenge was to take colleagues with us.
Good morning, Ward 3 staff nurse speaking.
And one of the important aspects is to integrate the consultant decision making that's going on 7 days a week to the working of the multidisciplinary team. One other major benefit of having consultant review 7 days a week is the feeling from consultants and all staff in the multidisciplinary team about how much better Monday feels. So we're not postponing work decision making that could have or should have happened at weekends and bank holidays until Monday, when we know we will be under acute pressure in terms of bed capacity. We're actually maintaining that senior decision making 7 days a week, and if a patient can be discharged on a Saturday or a Sunday, they're going out on a Saturday and a Sunday. They're not waiting and occupying a bed on a Monday morning.
Walking back into the office on a Monday morning is much easier for us because we know that somebody's been in on the weekend and we don't have an influx of nil by mouth patients because they've been dealt with over the weekend. In the last 3 months we've saved 50 nil by mouth days, so our patients start eating and drinking more quickly and they don't have to wait till Monday morning when a speech and language therapist would usually come on into the hospital.
One of the driving forces for us to really implement 7-day working this time around was the safety aspect of some of the patients that were being treated at the weekend by inexperienced staff with very little support.
Often the busyness of junior doctors covering a number of wards doesn't provide the type of review that a new admission to a medical ward or an elderly care ward requires.
Right, all the best.
The benefit of having ward rounds with consultants on the weekend is that you have more contact as a junior doctor with a consultant, and therefore are able to engage with the consultant in formulating a management plan. And in this way, it benefits me from a training point of view, and the fact that I have more learning opportunities.
The introduction of the 7-day ward rounds has phenomenally increased the quality of patient care that we provide. We now have direct access to specialist services, specialist advice, and time-based decision making in order to provide quality patient care. This has improved communications between the consultants and the patients and the nurses who are working over the weekends. It's also improved our length of stays. It's also helped us to escalate discharges quickly, and the referral system to other specialists has also improved. We can implement treatment plans that are right for the right patient at the right time, instead of waiting to go through a referral system and then actually getting that specialist advice. We've seen a reduction in our serious untoward incidents and also other incidents with medication errors with introduction of 7-day working.
7-day working has a massive impact on the success rates for patients undergoing assisted conception. We can be more in keeping with their natural cycles, so if a patient needs treatment over a weekend, we can actually go ahead with natural cycles rather than using drugs and stimulated cycles. For assisted conception, it's not an emergency service, it is an elective service. So patients have a choice of where they can have their treatment, and in order to be a provider of choice, we need to be able to provide the service that the patients want when they want it.
Today in Britain, there are somewhere around 6 million carers in the United Kingdom. 1.5 million of those 6 million carers are over the age of 60.
So you're both supporting each other?
And it's been estimated that the caring duties that carers perform for their nearest and dearest or neighbours or friends is potentially saving the NHS £119 billion a year. Right. So there's something about understanding what's the needs of the people that we're looking after and their family members who are providing the care.
I sometimes feel it's more difficult being a carer when I'm not feeling exactly 100% myself. Well, we couldn't manage without the team. The team have been... I've always got somebody at the end of the telephone. I don't know whether they appreciate just how valuable they are, actually. We would find it extremely difficult to manage without, I think. I'd rather have less money, let's put it that way, but I would hate to lose the carers and the teams that support us. Being able to call
any time, 24 hours a day, I suppose, is necessary. It's enormous help.
We are meant to be an alternative to hospital, ultimately. So in the past, you know, many people, elderly people with functional mental health problems or with dementia would have been admitted, and now we're trying to prevent those people going in. People can be discharged when 7-day support is enough, as opposed to when they are fully well, and there's a difference. I think if it was only delivered over 5 days, we simply wouldn't be able to do the job. We have teams in the Trust where we're still in the various stages of rolling out this kind of team who are working 5 days, and you're very limited at being able to prevent an admission or facilitate a discharge because people's lives don't happen on a 5-day week basis, they happen on a 7-day week basis, and the problems that they show and, you know, the things that need overcoming happen every day.
It seems to me to be rather foolish to have all the expensive equipment, the capital equipment there, the expense of training doctors, etc. in the art of thrombolysis, and then only utilising them for office hours. How do you justify that people who have a stroke at weekend probably are crippled or would die, and if they had it during the week, they could be fit?
Having a 7-day-a-week service improves patient safety. For instance, if a patient has a TIA on a Friday evening, if there's no 7-day-a-week service, they would have to wait for a Monday morning to come in for their scan. And if they have a significant stenosis, that means they've waited 2 extra days. There's a delay in commencing their treatment. It means that theatre slots may not be available till possibly later in the week or even the following week. So again, it delays treatment and surgery. And that might impact on the patient in terms of we know their patients are at higher risk of having a stroke following a TIA, and any delay could increase the risk of them having a major stroke. People ask if all services should be 7-day a week. I don't know about that, but I know personally working in the TIA clinic, I'd feel unhappy knowing that people didn't have access over the weekend and the consequences it might have for them.
Working 7 days has proved to be a real bonus for our patients. I think as a team we've always felt that 7 days is more appropriate for our patients. It's not fair to say to patients you're only important 5 days a week.
Our challenge to you is to think about how are you actually learning from your patients and carers that use your services. Think about how you might use them as partners in looking at your current services, and they'll help you to think about where you might focus your areas for change. So the question is, do you believe that the high quality service that you're providing is meeting the needs of the patients and carers who use it 7 days a week?